we are going to discuss the topic of shock, some important MCQ. So first thing what you must have to remember that most common shock in the surgical department, answer is hypovolemic shock. Then most common cause of hypovolemic shock in the surgical department, answer is bleeding or hemorrhage. Okay, so any patient with shock comes to you, so you have to assume it as a hypovolemic shock patient. So you are going to give IV fluids to the patient, and if there is a history of any infection, then along with IV fluids you have to give antibiotics to the patient. Okay, so that will be your patient. So patient with the history of infection, for example, most common cause of hospital acquired infection, answer is urinary tract infection. So it can lead to sepsis or septic shock in the patient. So you are going to give IV fluids plus antibiotics to the patient. If still the blood pressure of the patient is not managing, then in patient with septic shock, please remember the drug of choice is norepinephrine. This is a very important MCQ, you must have to remember. Okay, then very important thing, that all shocks are having tachycardia, but there is only one shock in which the patient develop low heart rate or bradycardia. So the answer is neurogenic shock. So please remember, for example, patient with road traffic accident, if it comes to you with low blood pressure and increased heart rate, you have to think of hypovolemic shock. Road traffic accident, low blood pressure, low heart rate, then you have to think of neurogenic shock in the patient. Then in relation to the anaphylactic shock, there will always be a history of drug allergy, bee sting, okay, or food allergy. Okay, and please remember anaphylactic shock starting from letter A. So the drug of choice for anaphylactic shock, answer is adrenaline.